I'm John Lee. I am an emeritus professor of epidemiology at the University of Washington. I'm in my low 80s. I retired about 13 years ago. But that was a fiscal retirement, and I've continued. I've been very lucky to be able to go on doing what I do or did intellectually, and in fact we're working on a paper to be sent off to a journal in a couple of weeks' time. I went to medical school in Edinburgh, Scotland, and of course remember that in Europe people go to medical school or indeed to law school as undergraduates. They don't have the college requirement along the way. By the way, I did a science degree. I interpolated it by picking up courses as I went along. Spent an next year with extraordinarily, considering history, this was a biochemistry degree, and I spent a 1/4 course on DNA before Watson and Crick, and the penny had not dropped. We all we worked away at the curious chemical properties of DNA without the slightest idea that it carried the genetic information. Yes, exactly. It shows. So anyway, went into the British Army and had an interesting time in Southeast Asia. The British were having trouble in the late 1940s, early 1950s with a communist insurrection in Malaya, which interestingly the British government, which was an old line socialist government at the time. I mean, it nationalised the railways and nationalised this and that and t'other, but was, I think, nobody told me at the time, I was just at the bottom of the heap, but they were democratic socialists, and they were very, very upset with Marxist-Leninist socialists, and that made them make this, well, I don't know if it made them, but they made this very large military effort to suppress the communist effort in Thailand down into Malaya, which they did successfully. Very, very curious. So then I came out, extracted myself from that, and went to the London School of Hygiene, did my postgraduate training in public health with a very limited epidemiology and statistics training, and then after a fellowship went to work for the British Medical Research Council in a unit run by Jerry Morris, famous. He's still alive, must be in his high 90s by now. The man who actually invented the whole business of exercise being good for you. The original first and only, well, first study, the comparison, if you please, between London bus drivers and the bus conductors that they had on buses in those days. And of course the bus conductors ran about collecting fares and ran up and down stairs, whereas the bus driver sat and drove his bus. And the bus drivers got fat and the bus conductors stayed thin and had much better health So there you were. So that was, I didn't work with him particularly on that. After a hitch doing that for a number of years, it sort of became, I was sort of getting a bit restless and thinking about something else to do. And I was grousing to one of Mickey Willard, long dead now, one day when he came to see us in London, that I was thinking about. There was absolutely nothing wrong with my relationship with the Medical Research Council or with Jerry Morris, but I'd just been doing much the same thing for a while, and I was sort of looking for a change, and we all knew each other, and people all do know each other. And Mickey Willard mentioned this to Jim McCarroll, who was in process of recruiting for the school here. At least not, it wasn't the school then, of course it was the department. So, now, you asked me about the foundation of the school, and you would, well, as I say, I came out here and gave a talk, and no doubt people collected letters about my then intellectual abilities. But and this curious business of this very casual talk to one professor in the medical school representing the university, and neither he nor I had anything in common except a general sense of goodwill. And that was the sole contribution of the outside to this process of me being offered a tenured professorship, you see. But what I was going to say was that when I arrived in the on this visit in the June of 1966, the current building of the School of Public Health was nearly complete. So I think that, and I don't know, the politics of this was clearly done by Tom Grayston and Russ and Jack Hatland and George Kinney. The deal was essentially done. It was somewhere along the line it became clear that Senator Magnuson had kindly provided $5 million for the building, and it was clearly much too big for a Department of Public Health in the medical school, so that even at that early stage, if you like, the heavy lifting had been done. It was funny because the regional medical program was a grand vision of bringing data to apply to medicine, and so that everybody would become much more efficient. And of the regional medical program, one of the features of the legislation was that the money was not to be used for the construction of buildings. So we needed $5 million to build a building, and somebody, presumably Tom Grayston, talked to Magnuson. And Magnuson said nonsense and had a small rider injected into the bill, so that we got our money. And as I say, when I walked onto the scene, so to speak, there was the building nearly complete. So that if you want to go to the roots of the school, you have to go to whatever. You have to go back to Tom Groston. One of the sad things, of course, about doing this sort of exercise is that you're just a bit late in the game. That Russ has gone, and John Fox has gone, and Donovan Thompson has gone, and a whole lot of the Carrie Hall has gone, who all sorts of people, and the various ladies who ran the labs for Tom, and San Pin has gone. You see, San Pin Wong. So there's a large amount of knowledge which has disappeared. Well, yes, you see, it all comes back to Jack to Tom Groston. He had the vision and invented the thing, essentially. I mean, there were people who helped enormously, but without him, nothing would have happened. At least nothing resembling what happened. In a way, you can argue that everything flowed from that. You had the building, you had the impetus of Tom and the whole chlamydia business, and then Russ and Jim McCarroll, of course. He had large ideas on doing environmental experimental respiratory physiology with exposure chambers, human-sized exposure chambers and things like that. At some point in time, don't remember the precise year, Jim went off to EPRI, the Electric Power Research Institute. And then died.
John, this might be a good time to ask you for your recollections of some of those early major figures in your division and in the department. Russ Alexander, John Fox, and others.
Russ, well, again, we don't overlap intellectually. We used to go to each other's seminars and all that sort of thing, but I worked on, and part of the object of, or part of obviously what attracted Tom and Jim McCarroll was that I was interested in cancer, whereas other people weren't interested in cancer. So this gave an extra bit of a dimension to the school. Interestingly, at the time, I was very keen on studies on childhood leukemia. And I'm, with hindsight, extremely sort of glad that chance took me out of that field, because nobody knows more about childhood leukemia than they did 40 years ago. They can cure it, which is great. And so from an individual child's point of view. But why kids get it is, we have sort of several studies with relative risks of 1.6 and things like that, which don't add up to anything. So no, that was that. But anyway, no, Russ is again a curious personal trajectory, because he was half raised and I'm not sure of the details, but his parents were orchestral musicians, and operated both in the Chicago Symphony and in the Halley Orchestra in Manchester. And so the infant Russ got a sort of bicontinental evolution of himself, and actually wound up with a choice of whether to go to medical school in Britain or in Chicago, and chose Chicago. But so we had a lot of curious sympathy with each other. No, it's fascinating. As I say, I work on the melanomas, and the HPV viruses, of course, are a potent source of cervical carcinoma, which is a squamous cell carcinoma, and I'm going off to take part in a discussion on Friday at the Hutch on the place of HPV in the causation of regular squamous cell carcinomas of skin. Now, I have no idea. I mean, this is a wholly new idea, and what it means, I don't know. John Fox and Joris Foy had an enormous scheme called Virus Watch. And this was the idea of following half a dozen characterizable viruses through a child population. And it went on for years, and they could follow the rise and fall of different sorts of sources of snivelings and earaches and all the other things in small children. It was a massive effort.
John, please tell us, if you would, about your own research.
I am not a great collector of data. I don't go around interviewing patients, and I don't. In fact, I'm rather. There are various eminent persons who write great papers where there's lots and lots of data, and they barely acknowledge the hard-working interviewers or the hard-working people who have actually gathered the data. But anyway, I don't do that. I tend to see reality, and it's again through the large data systems that are developed in Western societies. I mean, death rates and so on, I have been very lucky with although I did have some involvement in the early development of the SEER program, the Statistics, Epidemiology, and what is it? SEER, Statistics, Epidemiology, and Results program of the National Cancer Institute. And that is a very clever, if you live in a Scandinavian community, you say that we need to have information about every cancer case in the nation. And all the Scandinavians, having great confidence in their governments, agree, and you can have cancer registration right across the board, of the national one. Now, Anglo-Saxons can't, and won't do that. so that you are stuck with taking individual enthusiasts who will collect all the cancers, shall we say, in the city of Birmingham, or Birmingham, Alabama, for that matter. But then they get very difficult to generalise from, and so people like Sid Cutler in the National Cancer Institute decided something had to be done. And there was the state of Connecticut started a Scandinavian level kind of statewide system going back to the 1930s. So what they did was they found bits and pieces around the US where there was sufficient interest in the medical community, particularly among the pathologists, and where this wouldn't be regarded as a communist plot. So that the SEER program got going in initially half a dozen areas in the United States, which, and this is the clever trick, and it still worked perfectly well. With a bit of tweaking, it got big enough to be generalizable to the whole United States. It's nowadays about 10% of the population, so that you don't have to bring in the unwilling, the areas or the places or where the politics won't work, you do develop, and they have developed, and of course this is done on the basis of federal money. You can't do this for free. So the SEER program got going in about the very early 70s. I wrote my first melanoma paper in about 1972. I can't remember particularly, except that melanoma is a nasty tumour and its incidence is rising, was then rising quite rapidly, and it just was interesting. So I applied myself to it and was able to write a series of papers which sorted out fairly well the descriptive epidemiology of it. It's really quite sad, and we don't know I don't know the answer, nobody knows the answer. The only thing you can do with a melanoma is diagnose it early and excise it surgically. There's no effective chemotherapy, or only every clinic has the odd fluke of somebody who gets some vigorous immunological assault of some kind, and they then get, to everybody's amazement, cured. And every clinic tends to have a couple of patients like this who get wheeled out every time there's a visiting fireman. But on the other hand, nobody can reproduce this, and it's just totally frustrating. Equally, the biochemistry of the cells is strange, and you ought to be able to, you would have thought, jam a screwdriver into it somewhere, but nobody's succeeded. So I've gone on more or less fairly slowly and from time to time writing papers on the way the disease has evolved. The great puzzle at the moment is that, the disease stopped getting commoner in people who were born from 1950 onwards, which means they're quite middle-aged now, but it's stabilised. And it's stabilised both in high-rate places like Australia, which is not really suitable for white settlement, although I occasionally say that when I'm down there. But it's there it is. We don't really know why. This has been described by, I added up, it was something like 11 different studies. I mean, they're all giving you the same answer. Nobody quite knows why. So this is the sort of thing we're working on at the moment. It's difficult to articulate, but there's a real cultural difference between epidemiologists, whether they're physicians or whether they're PhDs, it doesn't matter, and statisticians. They're trained quite differently, of course, and work together closely and intimately. And of course, from an epidemiological point of view, or an epidemiologist's point of view, I would say that the best statisticians who have matured for no doubt several decades mature into epidemiologists. Now, I mean, people like Norm Breslow is a perfectly fine epidemiologist. The fact that he can do run curious stochastic tests in his sleep is of no particular importance. But there is, and at the moment I have the privilege of working with a couple of young, true blue statisticians, and we have the usual business of trying to communicate with each other, and it's just very interesting. I mean, no harm is done, but they go off and do daft analyses that I think are daft. And then we have to sit down and figure out why that isn't what I want. But it's a funny one.
Well, I'm not sure how all biostatisticians would take to your analysis of the difference of cultures, but I wonder whether you might have some comments about our iconic biostatistician, Donovan Thompson.
He was certainly a great colleague, and of course very self-effacing. He did good things, had a good influence without pushing himself. There was, of course, always the sort of tension, the shoving and pushing, not really, but between the athletes and the non-athletes. I mean, both Donovan and Hjordis and John Fox and Russ were all devoted golfers, would go and or would also go skiing. You see, these were and equally there were a fair number of us who didn't. And then you see the invention of the hutch, you see, and that gets very interesting with the determination of everybody to avoid the multi-institutional quarrels and difficulties of when we all go around with sort of silly grins on our faces saying we're not like New York, we're not like Philadelphia, we're not like Washington. And in fact, I mean, this has taken an immense amount of work, and with difficulties of funding, difficulties of turf, so that now you see we have things like the combined clinical facility down at Lake Washington, which is a combination of the Hutch and the university and indeed children's. Bringing children's in, which was a giant, ancient charity and stiff with the old money and all the rest of it. Bringing that into a collaboration with first the university and then with the Hutchison took an immense amount of hard work.
Coming as you did before the Department of Preventive Medicine actually became the School of Public Health, you managed to see all four deans in action. I wonder if you could share any observations of their tenures with us.
Well, for one thing, from the early 80s, which I suppose would be in Gil Oman's tenure, I became PI of a contract with the Department of Energy, and that required much more people and more space than was available in the school. So I migrated down to the Hutchison. Actually, there's a sort of bureaucratic joke about that. The business of the whole slew of us, Tom Vaughan and various people and various technical people, there was really quite a sort of blob of people and blob of money. And we did manage to fund some students and so on. This whole circus went down to the Hutch because they had space and the school didn't at that point. And the obvious thing to do would have been to remove the contract to the Fred Hutchison Cancer Research Centre. But the Department of Energy bureaucracy blocked at this point and said, oh, no, you can't do that. We can't have you collecting data about the health of workers in the Department of Energy based on a cancer centre. Think of the public image. So we said, oh, yes, sir. So for years and years and years, because this thing went on for about 12 years, I was the PI, and I got half my salary, and the whole of the rest of the contract came to the Department of Epidemiology at the University of Washington, so that if they'd had, there was no suggestion that anything nasty associated with radiation. And then there was a whole slew of subcontract arrangements to shovel the money down to the Hutchison, and it caused trouble. It caused a lot of trouble to a lot of people simply for that curious little reason. So there, yes. But anyway, point was that I moved my physical self down to the Hutchison because I was sort of engaged with this DOE contract, which consumed my total activities as far as funding was concerned. I wasn't particularly engaged with the departments and of the school, for that length of time. So that while I had perfectly good relationships with each of the deans, I didn't have very much functional. Everybody cursed about this stupid subcontract arrangement that we were stuck with, but there it was.
You mentioned Bob Day as being a mover and shaker that followed Tom, and indeed put the school in a good position because of his energy and insight. And you were still quite involved with the school in the early days of...
Yes. Well, you see, the thing was that the American Association of Schools of Public Health has, should we say, standards. You can't be a school of public health and not have great chunks of intellectual activity. And we needed somebody like Bob to invent a Department of Health Services. And that, otherwise, I think we would have had great difficulty. I mean, we would no doubt have got somebody else, but somebody had to create the thing, and he did. The other twist, which we seem to have got round, and I'm not close to this at all, but we have, or we had for a number of years, we used to get fairly adverse reviews because of our lack of engagement with the social sciences. And, of course, if you're trying to organise society in a way to get disease control measures going or whatever, this is something which is fairly clearly necessary. Now, I'm not sure of the timeline of this, but we made a couple of attempts by recruiting hardline classical anthropologists. Both very distinguished gents, but they were both total failures in this sense. They were always disappearing off to their particular sort of hunter-gatherer populations in the back corners of somewhere, and weren't really of any use to us at all. One of them is now a distinguished, I think, chairman of epidemiology or whatever they have at Oxford. There was no doubt about his abilities, but it didn't work at all for us. You know, there was, so that. But I think we've now exorcised that particular demon, and the health services people have grown a social epidemiology concern which does that job for us, as far as I know. But no, we had a couple of Peter Kunstetter, and it was a funny one because, again, it's the sort of question of academic culture. You see that both these characters were extremely good at what they did, and they came along and did what they did, but it didn't do us any good.
That's a good observation. I'm glad to have that, because this was a part of building the school.
Yes.
And it may well have been that what we did is go down the right path with the wrong person, or the wrong path with the right person. But in any case, as you say, it didn't work for us.
No, on a couple of occasions. That was very interesting because I mean, I'm a bit sympathetic to this because by absurd chance I had been somewhat entangled with that sort of anthropologist when I was in the army in Malaya, and so I had a sort of mild feeling for hunter-gatherers and their strengths and weaknesses and problems, and and again the split between the agriculturalists, the Malay population, and the indigenous. So the Malays, who only arrived in about the 17th century, were working up the river valleys and driving the Aboriginal people
deeper into the hinterlands.
Yeah.
One person who I think you can tell us about and the strength of his studies is Palmer Beasley.
Oh, Palmer's extraordinary. I really do. Very, very enterprising, bright young man, exhuming epidemic victims in Peru, looking for viruses and running about. What Palmer did, there was a realization that chronic hepatitis led to liver cancer, and that both were endemic in Oriental populations. And Palmer managed to solidify the science of this relationship to a very thorough extent, and to convince the Republic of China, the Taiwan government, to get into a vaccination program with the idea of controlling liver cancer. And this is the first time that a human cancer has been controlled, or seriously influenced. I don't know. I haven't followed this recently, but seriously influenced by the use of a vaccine. It's a cancer which is quite closely associated with a particular virus disease, so that you vaccinate against the virus disease, reduce that chronic virus disease, and then you stop the malignant change, and that that really has worked in Taiwan. And as I say, in my view, that's worth a Nobel, but Palmer didn't get one. I don't know how he managed, as a round eye, to get into the works of the Taiwanese system, but he did, and got him to do the vaccination.